بسم الله الرحمن الرحيم. السلام عليكم طلاب المرحلة الثالثة. This is the third lecture in our nutritional series in community medicine. We will talk today about lipids. This is one of the important constituents in food, and it includes fat, oil, wax, and related compounds. They are found in the food and in our bodies. Lipids are insoluble in water, and they are soluble only in organic solvents like chloroform and ether. Classification of lipid: we have simple lipid, compound lipid, derived lipid, and miscellaneous lipid. We will talk about the first one, which is simple lipid, composed of two-part glycerol and fatty acid. There are natural types including triglyceride and vegetable oil, and there are synthetic as ester fat, which is of high molecular weight, including alcohol, wax, sterol, and non-sterol esters, vitamin D and A ester. So this is the simple type, or the simple lipid. Compound lipid, which means there is other component in addition to fatty acid. And here we have composition of, in phospholipid, it contains fatty acid plus phosphoric acid and nitrogenous base like lecithin, cephalin, and sphingomyelins. And other type of compound lipid is the glycolipid, which compose of fatty acid, carbohydrate, and nitrogen base. For example, cerebrosides and gangliosides. These are type of compound lipids. And sulfolipids is the third type, which contain sulfur-containing lipids. And the lipoprotein is also lipid plus protein. And the lipopolysaccharides, which is a polysaccharide containing lipids. These are the compound. The third one is derived lipids. Derived lipids, there are fatty acid and they are derivatives like prostaglandin and mono and diglyceride. Other type of derived lipids is sterols like cholesterol, ergosterol, steroid hormone, vitamin D, and bile salts. These are sterols. They are derived lipids, which means fatty acid and it is derivative. And we have the miscellaneous lipid like carotenoid, vitamin A, vitamin E, and vitamin K. These are miscellaneous type of lipids. So the chemical properties of fatty acid. What do we know about fatty acid? The length of fatty acid chain may be short, may be medium, or long chain. The longer the chain, the more solid the fat. The shorter is the more liquid. Degree of saturation is important here to know. Saturated fatty acid like stearic acid in the butter and in eggs, they are solid at room temperature, and we call it fat. The fat content is solid here. And if we have unsaturated fatty acid, it is liquid at room temperature like oil. So the degree of saturation, either it is saturated or unsaturated. When it is saturated, it is, as we said, solid at room temperature. When it is unsaturated, it is liquid at room temperature. And the unsaturated type, we have monounsaturated like oleic acid like olive oil and almond oil, and we have the polyunsaturated like linoleic acid as corn oil and sunflower oil. We have to know that triglyceride, it forms more than 90% of lipid in the body, and food composed of free fatty acid. So 90% of our body lipid is the triglyceride, and even in the food content. There are 24 common fatty acids, differ in the chain length and degree of saturation. And we have to know that the lipid composed of fatty acid also it composed of carbohydrate. The lipid of fatty acid here composed of, as we see here, carbon, hydrogen ion, and the oxygen. Some of them are saturated. There is no double bond around the carbon atom. See, this is the saturated type. There is no double bond between the carbon atom, while the unsaturated here contain double bond as this one. Either it is monounsaturated if it is one double bond present, or polyunsaturated if it is more than one double bond is present between two carbon atoms. Triglyceride is the most in most food of animal origin. Usually it is saturated, while triglyceride in most of food of a plant origin, it is unsaturated, except palm oil and coconut oil. It is saturated as well as the animal origin food or triglyceride. So freshwater fish and seafood contain predominant unsaturated fatty acid. So it is a preferable type of food. The saturated, this is not preferable one. We prefer the unsaturated fat. Cholesterol is present only in food of animal origin, especially the organs like liver, kidney, and the brain, and it is absent in the plant food. So it is important to know that these organs are heavy of cholesterol. It is present in natural form. 90% of the cholesterol present in the cell membrane and myelin sheath, which is important for synthesis of folic acid and some hormones and the brain growth in children. So it is important to take these type of meat like liver and kidney if there is need to maintain the myelin sheath and the CNS growth in children, especially the brain. So what's the importance of lipid? Why it is important? First of all, it is major source of energy. It is not that it is stored in the form of lipid in the body and fatty tissue. And also in a time of a protein sparing action for tissue synthesis. What do you mean by that? Protein sparing, amino acid sparing is the process by which the body derives energy from sources other than protein. So the other source of energy is lipid when there is lack of a protein intake. Adipose tissue help to hold body organs and nerve in position. And we have to remember that the subcutaneous layer of fat, it will protect the body and preserve body temperature. And transportation and absorption of fat-soluble vitamin and calcium is important in the presence of these lipids. And they depress gastric secretion and slow emptying time and improve digestion, and it will add palatability of food. So what's the problem caused by lipid? Insoluble and floating over water. They are floated material over any eating subject. They will decrease their excretion outside the body, and when there is an increased intake, lead to obesity. So when we took lipid, they will be float over water and causes their excretion outside the body is decreased because they are floating. And so when we took a lot of lipid, it will increase in the body and remain there, especially if in sedentary lifestyle there is no activity, it will end with obesity. And over intake of fat soluble vitamin lead to hypervitaminosis and toxicity, especially of vitamin A and vitamin D. In mixed meal containing carbohydrate, protein and fat, here we have to recognize that the fat will float over them, and it will causes a delayed emptying from the stomach, causing indigestion. The increase in fat and cholesterol intake lead to cardiovascular diseases, in addition to obesity, as we said, and the oxidation of lipid leading to turbidity. Reuse of lipid in frying causes health problem. They never should use again fried lipid. Okay, essential fatty acid. There are two groups of essential polyunsaturated fatty acid. The body cannot synthesize them and must be provided from the diet, like omega-3 and omega-6. Omega-6 is linoleic acid. It is found in the corn oil. And omega-3 alpha linoleic acid, it is found in olive oil and in fish. We should supplement our body, and especially for children, with these two types of essential fatty acid. They are important for the growth of the CNS, of the brain, and of the also of the eyes for vision. What's important, as we said here, important activity of essential fatty acid. It is important in formation of cholesterol ester and plasma phospholipid and the mitochondrial lipoprotein. So it is of vital importance. And also it's important to maintain the integrity of capillary wall and cell membrane. It helps to lower serum cholesterol because it has a key role in transportation and metabolism of cholesterol. and help in prolongation of blood clotting time and increase fibrinolytic activity. It is important for the growth and for skin integrity, for fertility, maintenance of RBC, red blood cell structures, also for the formation and function of cell membrane in retina and CNS, and it'll help regulating blood pressure and immune function. So if there is deficiency of essential fatty acid, it will end with a scaly, dry skin and eczema in the neonate who fed on the canned milk, which is deficient in linoleic acid. And there is liver impairment, poor wound healing, growth failure, and vision impairment. That's why we have to supply the neonate especially with these essential fatty acids. Cholesterol present only in animal food, and it is essential component for structure membrane of all cells, especially the brain and the nervous system. Two sources of cholesterol, either it is exogenous cholesterol from food or endogenous. It will be synthesized in the liver and intestinal cell and stored in the liver. 80% of cholesterol metabolism is to be converted to bile salt, to bile acid. Cholesterol and bile acid are reabsorbed continuously from the intestine by the intrahepatic cycle of cholesterol. This is the metabolism. As we said, we have endogenous, it will formed here inside the liver, and exogenous, it will be taken from the food. So dietary fact of lipid. Each gram supply 9 kilocalorie, and high intake of dietary cholesterol increase serum level by few milligrams per 100 ml, while dietary intake containing only saturated free fatty acid, it increases the cholesterol level by 40 to 50 milligram per 100 ml. Dietary intake of polyunsaturated fatty acid like corn oil and the monounsaturated fatty acid like olive oil, they decrease the serum cholesterol, so better to use these type of oil for older patients and for those with lung disease, with cardiac problems, and so on, and especially who have high level of cholesterol. Dietary fiber also decrease serum cholesterol by binding to bile acid, and prevent their absorption. And stress increases serum cholesterol. We have to remember that. How to calculate the daily gram of fat requirement? To determine the appropriate energy need in kilocalorie per day, we multiply it by 0.25 for 20% oral intake of this type of fluid for adult, or by 0.3, which is equals to 30% of intake for children. And after that we divide that number by 9 as kilocalorie for each gram fat. So if we consume per a day 1800 kilocalorie per day, so we will multiply this amount by 0.25, it is equals to 450 divided by 9, it is 50 gram fat per day is the daily requirement. And we use food consumption table for a gram of fat for food serving to know the amount needed to prevent adiposity, and should be of mono or polyunsaturated lipid. It is not required to give a saturated type. Fat in food, there are different types. We have cholesterol is the waxy substance found in all human tissue and animals. All animal source of food contain cholesterol: meat, fish, poultry, eggs, and all dairy product. The highest source is present in egg yolk and organic meat like liver and kidney. So the butter and margarine contain 80 grams. We have the cream cheese 10 grams per 1 teaspoon, and cheddar, it composed of 14 grams per 1.5 ounce. Ice cream 7 grams, milk 3 grams, leaf and beef, fish 6 grams, eggs 5 grams, nuts 22 grams per ounce, and French fried 8 grams. Carrots and potato, there is a trace of fat. So we will talk about lipid metabolism. The main process of lipid metabolism occurs in the small intestine by the bile juice and stimulation of the pancreatic lipase enzyme. Triglyceride here by presence of the lipase, as we said, it is a pancreatic enzyme, and the bile juice, bile acid, it will be transferred to to monoglyceride and 2 fatty acids. They will be absorbed from the duodenum and jejunum, while the bile salt absorbed from ileum. Then the monoglyceride and fatty acid by esteration will form a new triglycerine. And the triglyceride here will have again the same chain. This will transport by the lymphatic vessels to the superior vena cava to the liver and will form acetoacetate and then acetyl-CoA and enter the Krebs cycle, which is a type of oxidation that is unusual source of energy. It occurs when there is hypoglycemia, when there is decrease in amount of carbohydrate or protein in the body. So we'll use the lipid as a source of energy instead. In case, as we said, of starvation or in hyperglycemia and DM, there is decrease in carbohydrate in the body, or in the utilization of the carbohydrate, there is an increase in oxidation of free fatty acid, and this will increase in acetyl-CoA and acetoacetate and beta-hydroxybutyrate and acetone. These all are ketones. They lead to formation of ketosis, and there is increase in the blood acidity and forming of blood acidosis. And ketone bodies will be seen in urine. Sometimes this is very severe and lead to coma. This is the pathway, as we said. Here the triglyceride by the lipogenesis, and we have hydrolysis. It will form fatty acid, and the fatty acid will change to acetyl-CoA and ketone bodies. And it will here acetyl-CoA enter the Krebs cycle, and it will elaborate energy. And here is the other pathway of energy production using the lipid. And thank you very much.